Greetings and welcome to the Southside Help Center show. I'd like to thank everyone for tuning in and taking an opportunity. If you have any questions about anything we're going to be talking about, give us a call here at the station. The number is 312-738-1060. We have our super phone operator extraordinaire, Shauna G's, on the phone, so please put her to work and give her a call. And if you have any questions, please do give us a call. Southside Help Center has been in business now for about 25 years, and it has been a wonderful ride and a wonderful journey, and it's only because of the community that we've been allowed to be such a service to you, so thank you. Again, if you'd like to check out more about our programs, go to our website. It's www.southsidehelp.org. www.southsidehelp.org, or you can visit us on 104th and Halsted. Our address 10420 South Halsted, or you can call. Our number is 773-445-5445. Again, thank Betty Smith, who is our founder for Vision, and Vanessa Smith, who is our executive director, for allowing us to continue to have a vision. Today's show, we're going to talk about prevention, and one of the reasons we're going to talk about prevention is because just on the way over here, I was really thinking about one, how much prevention means across the board. We had our back to school event on Saturday, and I was looking at the kids coming home from school today, and I said, okay, school is back in for a lot of our schools. By next week, everybody will be back in the school. And the thing that I was looking at and thinking about was prevention and how that works, and how the Southside Help Center has been providing prevention for so many years. And primarily, we started out with HIV prevention across the board. We're talking about making sure people were getting tested. We provide free testing. That's one of the programs that we provide. Also, people who are HIV positive, providing them with housing, providing them with case management, providing them with group. Families could be a part of that. That's another program that we offer. Also doing capacity building, because we've been in the field for so long. We've learned some levels of expertise, and we can pass that on to other agencies on how to be effective in their communities. That's the Bank Project. So prevention goes a long way. Also through street and community outreach, where we're able to provide safety counts. Safety counts is a harm reduction program. Before, it was such a big deal when we started talking about needle exchange programs and how that would affect it. We looked at all of the pros and cons of needle exchange. Other agencies like Recovery Alliance, who've been providing that service for many years. Also UIC, who have a needle exchange program. And again, harm reduction is important. And the reason we look at harm reduction in such a light is because so many people have had battles with substance and drugs and substance abuse on one level or another. And so many people have had been blessed to find their way back. And the one thing that we think about is the people who are caught up in that vicious cycle are good people. You know, they're people. They are our mothers, our fathers, our sisters, our brothers. And so oftentimes, if you're not that individual, we look upon them or frown upon them or become extremely judgmental. But the one thing that people who have been dealing with substance abuse or have had the opportunity or been blessed enough to make it back know that those people are people caught up in the disease of addiction, and understanding that it is a disease and that it is a process, and that hopefully they will find their way back. So meanwhile, until that happens, we want to provide them with the safe environment. We want to provide them with a way to stay healthy until they make their way back, because again, it's not about us being judgmental, and Safety Counts offers that, and also other agencies who's been providing harm reduction for many years, like Recovery Alliance, like UIC, who have much compassion for people who have been caught up in the cycle of disease of addiction. So that's another program that we look at. So when we start looking at prevention and harm reduction and how that works, it's so important that, again, we start early with our youth as well. When you look at the fact that the kids are going back to school, we start looking at the fact that, you know, we do deal with a lot of gang violence in the city of Chicago. We do deal with a lot of shootings in the city of Chicago, so many different things. How do we prevent our kids from getting involved in those things? And again, it's with programs. Our after school program is starting up as well. So parents, take advantage of the Southside Help Center after school program. Get your kids involved in programs. So please do give us a call at the agency, 773-445-5445, and speak with Mr. Marcus Flanall. He is our youth director, and get those kids involved in those after school programs. Help us to help you. I find that prevention works so well when we have parent involvement. And again, we talk about prevention and intervention because there's a big difference in the two. Prevention happens before a problem actually exists. And then intervention is that comes along later. Once we see that there's a problem, we identify it, and then we come in and see what we can do to make changes or to fix the problem. So it's important that we do prevention before there's an actual intervention needed. I know you guys watch the show Intervention, and they come in and they got so many people who are caught up either in substance abuse, either drinking or so forth, and then they have to do an intervention where they come in and try to save someone's life. Well, we look at prevention in the same method. How do we prevent our children from getting caught up? How do we get our young people involved in programs and our parents involved in programs with our young people so that we don't have to do an intervention later? And that's what prevention is about. And that's what we've been providing across the board for 25 years with all of the different programs that we offer. When we start talking about HIV prevention, how does that work? Well, we want to prevent it before individuals test positive for HIV. So what do? You get condoms. You use condoms. Condoms are 99% effective when used correctly. We have a condom distribution program, which allows us to distribute condoms throughout the south side of Chicago. Also, talk about abstinence. Not just talk about abstinence when you're talking about when you're talking with young people. We have to give them alternatives, because peer pressure is an extremely powerful thing. And even though we have done some great parenting, peer pressure can come along and tear that down in a matter of 5 or 10 minutes. And that's what alternative programs do, is help to combat peer pressure and things like peer pressure. So it's so important that we just not talk about abstinence. What does that truly mean? When we start looking at sexual responsibility, what does that truly mean? We start to look at procreation. What does it truly mean? And how often do we talk about that as parents? So that's when we, people always see us on the street. Why y'all don't talk about abstinence, right? Well, we do. But the reality of it is you don't. So, and if it don't apply, let it fly. If you're in your house talking about abstinence, procreation, if you're in your house providing them with what you need, and if you're not, that's fine. But we're saying that it's important that we do have or highlight these topics of discussion and have them so that our kids can look at what alternative programming is, and then when they get to combat it with peer pressure, they actually have something or someone that they can actually turn to. And when I say help us to help you, parents, we understand that parents have a job. Their biggest job is providing food, clothing, and shelter for our children. So understanding that we have to work. We don't have a choice, because we want our children to have food, clothing, and shelter. So therefore, we don't always have the necessary time that to be able to provide them with some of these alternative programs. And that's what I'm talking about today with the Southside Help Center. If you'd like to check out more about our programs, please go to the website. This is a live call-in show. Our number here is 312-738-1060. Please give us a call here at the station. We're talking about prevention and how you can help, or how we can help you. And it's so important that we do it as a collaborative effort in terms of parenting. When we start talking about a village raising a child, what does that truly mean? And that's just across the board. And earlier this week, we was talking about, as fathers, what our roles and responsibilities are. So oftentimes we do get a lot of pressure, because so oftentimes we don't, when I say we, I'm talking about us as African-American men. We don't always do what we're supposed to do for a number of different reasons. So I don't want to get on sometimes we can get really aggressive and judgmental about our African-American men, and we do know that some of them need to man up and do what they're supposed to do as fathers, and do what they're supposed to do as husbands, boyfriends, as parents, and so forth. So we're not going on that. We're talking about what we can do to help you to be the best that you can possibly be in terms of a parent, and how we can prevent some of the situations that we actually run into as time goes on. Give us a call here at the station if you have a comment, if you have a question, if you have a concern. Please do give us a call at the station. This is a live call-in show. Our number here is 312-738. Give us a call if you have a question or comment or concern. We're talking about prevention and how the Southside Help Center can be a service to you. One of the things that we often talk about is the programs that we have to offer, because we've done the research, or we've done this, that, and the third, and these are the programs that we have. But a lot of times we don't get enough feedback as to what a good program could be. Now, don't just come up with something. We often talk about, how would this work? How would it be implemented? And if you have an idea, because we need your help. If you see something or a hole in a program or somewhere that the program can be better, please give us a call at the agency. Please come in, sit down, talk with our prevention specialists, especially those who are serving the community or actually providing services to the children. It's so important that that happens, that we get enough support in our community where we can actually provide quality programs. Because again, I found through our outreach, we think that we know, I don't want to say everything, but a lot of the things that we know, we're continuously learning through the people, and that's what's important. And we found that even in our incentive process, when we're having our groups and things, what we thought was important was not as important as what people we were servicing thought. So they also gave us guidance and direction on that. So it's important that as community residents, as community providers, that we come together on one accord and make sure that we provide the best services that we possibly can. The only way we can is with you. So this is Southside Help Center Show. Southside Help Center has been in business now for 25 years, and we've been providing programming. Please give us a call today. We're talking about prevention and how we can prevent HIV prevention, how we can prevent violence prevention, how we can prevent gang prevention, how we can prevent so many things before an intervention is necessary. Give us a call here at the station. We got Sean over there on the phone. The number here is 312-738-1060. Don't make me talk the entire time, because I will, but don't make me do it. So please give us a call here at the station if you have any questions about what we're talking about. We're talking about and doing a recap of the programs that we've talked about over the last several weeks, which is our after school programs. Again, school has just started. This was the first week back for a lot of schools. Some were last week, so now school is back in. And again, after school programs are so very important to our youth. We have an after school program. Parents, please do, for our younger and for our high school students, our grammar school and high school students. Please give us a call at the agency or come in and speak with Mr. Marcus Flanell, who's our Youth Development Director. So please do come in and talk with him if you have any questions about the programs and what time they function, what time they operate, and so forth. We got our caller. Caller, you're on the air. Yes, you're on the air, caller.
Yes, my name is Cal.
Okay.
I would like to ask you, what do you exactly help me with?
Well, again, what we do is we got many programs. So just to go over several of them. But again, if you don't get enough information about the programs that we offer, go to our website, www.southsidehelp.org. But some of the programs that we help you with, we got our after school programs that we're talking about with our youth. We got grammar school and high school programs. So please go to the agency, call the agency, or check the website to see what time those programs are functioning. Those consist of different programs, mentoring. Those consist of homework helpers, tutoring with our after school programs. We also provide free testing and counseling, and we talk about HIV prevention, and it's important that people know their status. Why? Because early detection is key. The earlier someone knows something, the better treatment and care that they can actually get. If people test positive, then they need to get in contact with their doctor. They need to get into treatment and care. If people that test negative, they need to look at what behaviors are positive, those that are negative, and make the necessary changes. Also, we have a program called Safety Counts. Safety Counts deal with people who are actively using. That means that people are using drugs. Again, it's a non-judgmental program to help people make decisions based on their own stages of change, meaning where they're at in their lives and what they want to do. And we'll go step by step, short and long-term goals, and help them identify what it is they want to do, and then help them to make those necessary steps. That's our harm reduction program. It functions on Thursdays over at UIC Satellite Station. We're in collaboration with UIC, which also has a needle exchange program, and we provide free testing at that location as well. Another program that we provide is called Bank. The Bank Project is a program that does capacity building. Capacity building meaning that if there's other agencies, if you work for an agency or if you know of other agencies who need assistance with programming, they can contact Ms. Pamela Tassin, and she'll be able to tell them or give them direction as to what they can do to get involved in those programs. We also provide programming for HIV positive clients. That means we have programs where we do counseling, where they have case management, they have individual case management, they have housing case management, meaning if people have test positive for HIV, they get them into counseling, they get them into housing, they get them connected with doctor, connect to care. We have a program called BTAN. BTAN is a connect to care program, meaning people who either have who have had HIV, who have tested positive, and was in treatment and care and fallen out, they can contact Louis Sprague, and he'll get them connected directly back into care, or people who test positive and have not found a primary care provider. These programs will help you and assist you and walk with you until you find the right doctors for you and make sure that you get into treatment and care. That's the BTAM project. So what we do is offer a variety of different programs at the Southside Health Center. We've been in business for about 25 years, so we've been doing this for quite some time. I think I got another caller. Caller, you're on the air.
Yes, by me being a convicted felon, how can you help me get a job?
Well, we make job referrals, and one of the things that we do, we get other agencies or job fairs. When they start to put on job fairs, they contact us because we do have a program that deals with people who are what's the term it is? It's newly released, or people who just coming out of jail or finna come out. Then what they do is they have programs that specifically for people who are coming out, and it shows them or give them guidance referrals as to what they can do. One, to either get their records expunged. Two, to get employment where people are know that what your background or your history is. So it's just it's all about referrals. So you can give us a call at the agency and find out what's available in terms of job placement or job referrals, because a lot of times we do get agencies who contact us, or we get job listings all the time, and it deals with people who are recently released in reentry programs is exactly what they're called. They're called reentry or recently released. So that means brothers who are coming out of jail who've been locked up for some time, and this just kind of give you a step-by-step process. As you it kind of lets you know right before you get out. They plug you into a case manager, and then they can help you step by step. So give us a call at the agency, and I can give you a little bit more information. 773-445-5445, and you can get me at extension 17, and whatever assistance I can give you in terms of referral, I'll make sure I get them to you, because again, we do have case managers who deal with individuals who have been recently released, and it'll give you some direction. So it's just a number of different programs or wealth of programs that we offer. We've been in business for 25 years. We've done programs with recently released individuals. We've done programs with HIV positive, HIV negative, after school programs. We do violence prevention. It's just so many different things. And the other thing is volunteering. Let me say this. So oftentimes you'll be surprised what volunteering can lead to. And the other thing is, people think that when we have our mentoring programs, we got male and female mentoring. They think that all of the mentors got to be these straight up and up individuals. What it is, it has to be individuals who are willing to make a difference or willing to make a change. So oftentimes, because we've had different experiences in our life, we have different experiences to offer. It ain't about, I've done everything correct every day of my life, and this is who I am today. And we do need you. Don't get me wrong. We need you, but we also need individuals who've made changes in their lives, who may have experienced some things and can show you, direct you, give you good information about what not to do, and talk about what those consequences are as a result of their actions. So we need brothers who, from both sides of the fence, for lack of a better term, to come in and mentor those young brothers. And again, mentoring is once a week, and it's not a lot of time. Oftentimes people, it doesn't seem like a lot of time, but it's difficult to get brothers and sisters to come in and give that time. So we are always looking for mentors to come in and volunteer. And you'd be surprised what volunteering leads to. And again, oftentimes when you get into the recently released and so forth, you want to do something. You want to do something different. You want to pay back. And it's important, man, that we get you plugged up into the right places and make sure that you get the necessary opportunities. Again, we got a caller. Caller, you on the air? Yes.
Hey, what's up, man? Hey.
You turn your TV down just a little bit for me.
Can you tell me, how can you tell if you got HIV, it's a body fluid or something, man?
Well, the only way to really tell is to definitely get tested. But one of the things we talk about is symptoms. We're careful with symptoms only because symptoms for HIV are also symptoms of other things. For instance, you may start sweating or have night sweats, but the thing that we look for is what we call prolonged symptoms, meaning that you may have diarrhea for a long time. That's what we call waste syndrome, for a couple of weeks, where you have profuse sweating, where you're sweating through your clothes, sweating all night, extreme fatigue, where you walk a short flight of stairs or a short distance and become extremely tired. But the thing is a lot of the symptoms for HIV are the same symptoms for other things, so we talk about making sure that an individual get tested. When you talk about body fluids, we're talking about how disease transmitted or how what body fluids is it found in its highest content. When you start looking at blood, semen, vaginal secretions, those are the body fluids which is found in its highest content. Although it's found in all body fluids, it's not in a high enough concentration that it can be transmitted in all those body fluids. So for instance, sweat, tears, saliva is not in a high enough content where it can be transmitted unless you're taking in a lot of those particular body fluids, and then you're putting yourself at risk. That's why we talk about mother to child, infected mother to child before, during, and after birth. Before, while they're sharing the mother's blood system through birth, because they're going to come in contact with a lot of fluids, and then after birth and breast milk, because the child will take in enough breast milk for them to put themselves at risk. So when you start talking about body fluids, we talk about those that is found in a high enough content in order to be transmitted. Also, the ways in which it's transmitted is through anal, oral, or vaginal sex with an infected person, through body piercing and needles, meaning that if you're sharing needles in terms of injecting drugs, also body piercing and tattooing. That's why we talk about going to professionals where they actually use new needles, because you can get HIV from sharing needles in that fashion. So it's important. We talk about going to the barbershop. Make sure you get a new razor, because again, a lot of times they draw blood on you, so you want to be careful of that as well. So you got your blood, semen, you got your anal or vaginal sex with an infected person, you got your needles, body piercing and tattooing. You also got your infected mother to an unborn child. You can't get it through blood transfusions. They actually designed the test back in 1985, so all blood is actually tested, so you can't get it in that way. How don't you get it? Through casual contact, meaning, befriending someone, hugging someone, kissing someone. So you're not going to get it from sharing the same bathroom, eating off of the same place, utensils that way. How do you prevent it? Abstinence, meaning that no sex, no drugs, no problem. Or getting a monogamous relationship. Monogamous relationship where there's commitment and trust is 100% safe. So you're talking about how don't you get it? You can use condoms. Condoms are very, very effective when used correctly. They're 99.9% effective when used correctly. So that's how you prevent the disease in terms of HIV. So it's important. And these facts are still true today. We were talking about yesterday that they have so many different prevention methods now. One of the things that they talk about is how they did a study where they tested people who were partners with people who were HIV positive. And if the HIV positive individuals took their medicines consistently and correctly, that the risk of transmitting disease was very, very, very low. Also, they looked at it as a prevention method. That's one of the things that they're talking about now, prescribing HIV meds for individuals who have high-risk behaviors, meaning that if you know that you're putting yourself at a great risk on a consistent and regular basis, they're looking at, there's one medication that they're talking about, not a whole regimen of medications, but they're talking about prescribing HIV meds for people who consistently practice high-risk behaviors as a prevention method. So, when we start talking about prevention and how far it's come, it has come a long way when you start talking about HIV. But here's the thing we want to make sure that people understand. HIV is a very, 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 I want to say dangerous disease. I mean, people don't want to be putting themselves at risk unnecessarily because there's still a lot of things that come along with it. Oh, no, it's not a death sentence. We talked about that. Early detection is key and positive. One of the things that people have to do is change behavior. We look at Magic Johnson and talk about him all the time because Magic has been HIV positive for 20 years and he still remains healthy, but he does everything he's supposed to do. He takes his medication, he has a relationship with his doctor, he's working out and exercising on a regular and consistent basis. So he does what he's supposed to do to maintain a healthy lifestyle, and that's what we're talking about. We look at change. So when we start talking about prevention and how HIV prevention has come such a long way, it truly has come a long way. And myself and Mr. Spraggins, Louis Spraggins, will be on the show, and we're going to talk about prevention and how far it's come. We're going to talk about some of the studies that they've done with people who are practicing high-risk behaviors and getting them plugged in on these meds. And again, it's what's necessary. We're looking at what we can do to bring down the risk of HIV the positivity rate or the epi rate is important, because now all of the programs are going towards positivity rates, so, but there's a lot of people that are positive, and that's why we talk about get tested, know your status. And the main reason is because if you are positive and you get tested and you know your status and you get involved in programming and get the necessary medication that you get connected to care, I mean, the quality of life just continuously goes up and up and up. So it's not about giving nobody a death sentence, being afraid. I would be afraid not to know, because that's why they talk about so many AIDS diagnoses. People are coming in and getting AIDS diagnoses because people are not getting the necessary testing early on. So people are afraid still of knowing their status, and what's happening is people coming in and getting these AIDS diagnoses, when it's so important that people know their status and keep a healthier quality of life. So we're going to be talking about prevention next time we come back. We're going to bring on Mr. Louis Spraggins. He's going to help us in talking about how far prevention has come away. We thank everybody for tuning in. We thank you guys for calling. If you need any more information, call us Southside Health Center. Number 773-445-5445, or go to our website, www.southsidehealth.org. Until we see you again, we bid you peace.